How does HPV affect when you start cervical screenings? How does human papillomavirus, commonly known as HPV, influence the timing of cervical screenings? This is an important question because understanding HPV's role can help us navigate screening guidelines effectively. HPV is the leading cause of cervical cancer, particularly the high-risk types. Current medical guidelines recommend that cervical cancer screening begins at age 21, regardless of whether someone has been vaccinated against HPV or their sexual history. This is because HPV infections are quite common, especially among younger individuals, and they often clear up on their own without any treatment. For women aged 21 to 29, the recommended approach is to start with a Pap test, also known as cervical cytology, every 3 years. During this age range, HPV testing is not typically used as the primary screening method. This is due to the fact that HPV infections are frequent but usually temporary in younger women. Using HPV testing in this group could lead to unnecessary follow-up procedures and anxiety. Once women reach the age of 30, the guidelines change. At this stage, cervical cancer screening can include HPV testing as a primary method or alongside Pap testing. Women aged 30 to 65 can choose to have a primary high-risk HPV test every 5 years, combined HPV and Pap testing every 5 years, or a Pap test alone every 3 years. The reason for this shift is that persistent HPV infections pose a higher risk of developing precancerous lesions or cervical cancer in older women. The inclusion of HPV testing in screenings allows for earlier detection of high-risk infections, which can lead to cervical cancer. This means that if HPV tests come back negative, longer intervals between screenings can be safely recommended. However, it is crucial to note that screening is not advised before age 21. This is because HPV infections in younger women are common and usually resolve naturally, and early screening could result in overtreatment. In summary, the presence of HPV significantly shapes cervical cancer screening guidelines. Starting at age 21 with Pap tests and incorporating HPV testing from age 30 onward balances the need for early detection with the goal of minimizing unnecessary medical procedures. It is also important to remember that being vaccinated against HPV does not change the recommended age to start screening. Vaccines do not cover all cancer-causing types of HPV, so individuals with a cervix should adhere to these standard screening guidelines, regardless of their vaccination status. Always consult with a healthcare professional for personalized advice regarding cervical screenings.